I'm just going live now. We are live. Doctor? Doctor, there's a noise coming out of your side.
Out of my side, let me.
I think it's your side. I just muted you. So it's like a TV station or something. Like, hello, and welcome to this program. As I have said some time ago, this is going to be an ongoing daily program where I will invite people from all sector of life to talk to our viewers about the coronavirus. As you know, the pandemic is growing fast in our communities, and everybody is worried. We are all sick, worried about how the impact of this virus. Yesterday, I had Dr. Ismail Abaji. We shared some of the supplements or some of the medication you should empower yourself with. And today, I was supposed to have Gambian who was infected with the virus, and he was ready to share his story. But as you know, we all have family members, and sometimes when our families are concerned about issues, we would have to respect that. And that's why a lot of us, especially those in the public arena, should come out and share their stories. That will empower a lot of people, because the stigmatization and the lack of having confidence to go out and speak, it's not just about the people that are infected, but it's also their family members. That's why it's important for us to have these conversations, talk openly about it, and let people know this virus is, it's not even like HIV. It's a virus that any of us can be infected with. And that's why today, last minute, I had to bring some of my friends to come and help me. I have with me Manyenya Dambell from the UK, and Dr. Tekanyi from the US. Guys, welcome to the program. Welcome, ladies and gentlemen.
Thank you for having us, Fatou. Thank you.
Okay.
Thank you very much, Sister Fatou, and welcome and thank you to your viewers.
Thank you, Doc. Manyenya, thank you very much. So first, I'm just going to give an update on what we have yesterday. Yesterday, from the Ministry of Health, it came in late. It came in this morning. We had 128 cases registered for the 3rd, which was released yesterday. So 128 people registered. I think this is a surge because the last report that came out was 178, but that was 3 days combined together. But for just on the 3rd of August, we have 128 registered cases. 2 people died. Today, we have 662 active cases. We have 16 dead and 115 recoveries. And the total number of people that have been infected in the Gambia is 799. That's almost 800 people.
Wow.
Also that's alarming. But also the Minister of Health, Dr. Samate, is checked in at the treatment center. The reason being he did a test and the results came inconclusive. If that happens, you are being told to isolate yourself for a number of days and take treatment just to make sure you are cleared from the virus, whether you have it or not, but you are advised to do that. So I was really concerned when the minister's results came out, because this is the man who is leading the fight against COVID-19 in the Gambia. These are alarming times. A lot of our elders are getting sick right now, and people are still not taking this virus seriously. But I'm very glad, I know you guys are not in the Gambia, but I can report to you that the enforcement is really, really going very well. You go out in the streets, you don't wear your mask, you are stopped and told to pay $1,000, or you go back home. The enforcement is really, I've not gone out for 2 days. Today is the first day I came to the office, but on my way to the office, everybody was wearing a mask. There's no gathering in the streets around the Senegambia to the Brusubi Highway. So that is only showing that we are taking it seriously, but I think we need to do more sensitization. So Manyenya, this is the update, and I'll let you come in. This is the update from 3rd August 2020 in the Gambia. I want to go back to 2019 because 2020 has been a really bad year for all of us here. You want to come in?
Fatou. Thank you for having me. And I'd like to say hello to the viewers and everybody that's watching. We are in very, very trying times. Life is not as we know it. We are losing loved ones, and especially in a country like Gambia, where we all know it's a third world country. Our healthcare system is not the best in the world. And we've got other healthcare systems, like in the UK, in the United States. It's slightly different because Manyenya occupancy and all that, but they are still struggling. So little old Gambia, we need to make sure as Gambians, I know that the government has some responsibility with regards to the COVID and whatever else is going on. But I think the individual responsibility as well needs to come into play. We need to also assist. We need to stay away from the clubs. We need to stay away from gatherings. We need to stay alive. It's as simple as that. We need to stay alive. So you have to follow the regulations. WHO, follow that. Wash your hands, wear your mask properly. I'm not being a video about is going viral. If it nyasi, how you're going to wear your mask, and that is very important. And also we need to sensitize. It doesn't necessarily only have to be people from the media, that have to come out and speak. If you have something to say, come out and speak, educate people, because do ham kan mo nek di deglo, because hin na dun dega Fatou today, why dinañ dega kenen, understand nga? So we need to come out and support each other. We need to unify, and we need to understand that we have to do our utmost to make sure that we get the government wearing our mask. And I'm just repeating myself again, but it is scary. COVID is very, very real. Over 4 million people have died all over the world. And in the UK, I think we have lost about 46,000 people. So in healthcare system is good. When they ask us to stay at home, we stay at home. Trust me, we don't go anywhere. So let's stay alive and make sure that we all make it to 2021.
Wow. Well, I'm hopeful we will, but
Inshallah, Rabbi.
we will have to do a lot of fighting and a lot of sensitization.
Sensitizing as well. Yep.
Yeah. Doctor, welcome. And I'm sure you have had the update. I saw it on your Facebook first before I even saw it this morning. What's your take on the recent numbers that are coming out from the Gambia?
Thank you for that very important question. It's important because it's illustrating the exact picture that Gambia is, demonstrating or showing out with regards to the pandemic. It is the coronavirus pandemic. But again, it is also telling us that, we are not yet ready. Ready in the sense that, it is just the beginning of the actual image of, the pandemic regarding how, the surge goes up. And so I had a review of the report. It says that there is, an increase of mortality, that is 2 more, and the infection rate, that is the number of people being infected was increasing as well as a reduction in the recovery rate. However, there's something that is very important with regards to that, report. One, it is telling us that, the Gambia is getting more of infected persons than, the recovered persons. And then there should be questions to that. Why are we having more infected persons than recovered persons? Is it because we are not following the outlined procedure or precautionary measures? Or is it because we are testing more now than before? Or is it because our people are more, are coming, let me say, becoming more responsive to, the measures that are being, outlined, and in the process, coming up for the testing to know the status and something like that. So there are so many questions regarding this, but what is very much important regarding the report is that Gambians need to understand that we have not even got to the real surge of the virus yet. We just seen a starting of, the surge.
That is scary.
Yes.
That is
Yes.
scary.
Yes,
I was thinking this is our peak.
In health and specifically in epidemiology, you need to speak the reality of the figures. You don't have to maslaha the figures to make people understand. You speak the realities. In fact, in speaking the realities of the figures, it will make those that are in denial accept that it is existing. Those that are reluctant of coming out to come out because they are knowing what exactly is happening. But like if you tell them that Gambia is at the mid of the curve now, they will tend to relax because ligite new eager see endemic of it. But if you tell them that that is just the beginning, we expecting more. If we don't do more, then they will come out. So in a nutshell, it is not a good image. It is just telling us that the thing is coming up. When we are going to get to the end, nobody knows. But the important thing is for us to know that it is just the beginning of the surge.
Wow, Manyenya, that is scary.
That is very, very scary. Coming from a doctor, it's very, very scary. And like the doctor said, we don't have to do the maslaha thing. We need to let people know exactly what is going on. People need to be aware. They need to be informed. So it is scary, very scary. Ninyangi there at Gambia,
I know, it's scary. And doctor, I know you were working at the Gambia health facilities, and the status of our health facilities. What do you think? Do you think we're able to control the surge, the numbers that are coming in? Because I know that I was talking to Manyenya 2 days ago, and the reason why I loved that conversation was I at the beginning of the conversation I said, look, Mr. Njai, I think let's be realistic. We know the health facility cannot accommodate what is going on right now, because I know people that have symptoms, they are still not able to get help up to today. It's 4 days into calling, they are still not able to get help. And so what is your take on our current health facility concerning COVID-19?
The unapologetic truth about the thing is that there is no health system in the world currently that can contain the surge of the coronavirus. That is the truth.
Yeah.
Be it the United States or be it Gambia, there is no health system that can, accommodate or contain the surge. However, there are systems that are trying to, improve in the containment strategy, and that is not the Gambia. Our system, we all know, has a lot of, shortcomings that needs to be addressed. However, the best way we could do to prevent overwhelming our healthcare delivery system is to protect the inner core of the healthcare system. And in protecting the inner core of the healthcare system, that is to make a robust outcore of the healthcare system. And to get a robust outcore of the healthcare system, we need to, get the isolation, done in as, much as we can, and try as much as possible to minimize the community transmission. Why? Because if we don't, at the end of the day, the external core of, the healthcare system will be defeated. Once that is defeated, then it will be the inner core, and the inner core is those responsible for the healthcare delivery, and that is the healthcare workers. So when the healthcare workers get exhausted, then it means, that will be praying to God. So, but the answer to your question is that we do not have that system that can contain a real surge of the virus or the pandemic. But we can minimize the effect it will have on our healthcare system when we maximize our, mechanisms, response mechanisms through the sensitization and, screening and testing. That will help us preserve the inner core of our healthcare system.
In the absence, Manyenya, in the absence of all of this, he's saying the lack of proper healthcare, like in all countries across the world, lack of resources, lack of even proper quarantine centers. What should be our responsibility as individuals, individual Gambians? Because now it has come to that point where we have to take our individual responsibilities, because now it's gone beyond what the government can handle.
Basically, for me, as far as I'm concerned, the way I've seen it is, when this happened, the experts came out, the people who know more than we do, us the mere mortals, so to speak. They've come out and they've explained to us. They've told us what exactly we have to do. Social distancing, washing our hands, avoiding going to visit our elderly family members. Because as you've noticed in the Gambia, it's the elderly that have been passing away quite rapidly. I think that we have to adhere to the guidelines. This is not time to say, I have to go and meet up with my friends. This is not a time, because when it was really bad in the UK, and you've got your, let's say, for instance, an elderly family member, they're living on their own. What people would do is they would buy them shopping and they'll just leave it outside the door. They will not even go into the property. And there are procedures also to do when you go and buy stuff outside. When you come home, make sure you disinfect and wash the stuff that you bought. Isolate yourself and make sure you keep yourself up to date. Keep updated so that you know what is going on in the world. Don't think that, this is a pandemic. It doesn't affect me. It does affect you. It is right at your doorstep and you need to do something about it. But man, one thing I want to do, and this question I want to direct to the doctor. Moine, let's say, for instance, because you mentioned earlier, there's Ninyage symptoms and they're calling the numbers, but they can't get through to the relevant authorities. What would the doctor advise, doctor? What would you advise to individuals like a Manyenya Dambell, for instance? I start getting symptoms and I'm feeling ill. I can't breathe. I've got a sore throat. What should I do to get a head start? Because what tends to happen is people fall ill, then you them tida. And then when you wake up, it's worse. What should an individual do at that point where you can't get through to the authorities? You don't have the oxygen or whatever else. What are the tips you can give to someone out there?
That is a very important question. And the answer to that question will be in two folds. Number one answer is regarding the inability to get access to the authorities. An answer to that one is there are always, ways to, the whole process. If you cannot get access through the 1025, for example, there will be another way of accessing someone else who could get access to the healthcare, the national response team. For example, if I try 1025, I cannot get 1025. I can still call Fatou and tell Fatou, well, I am experiencing these symptoms. And then so and so and so is what is happening. And I want you to help me get access to someone that could help me. This is to say that we don't have to get an excuse for not being able to access, the channel or the means of getting to the persons responsible or those that could provide the care or the service. That is number one. Number two, I always discourage the idea of, I saw on, online and everywhere, people saying the medications you should get to the house and all those kind of stuff. It is not my, like, or my, thought for people to have such kind of things. There is reason why people go to medical school to be doctors. There is reason why they go to law school to be lawyers. There is reason why they go to journalism school to be journalists. Otherwise, we could have all gone and buy textbooks to read and know how to treat malaria, or buy books to know how to be a journalist. So the answer to that question is, you don't have, and maybe I am assuming, maybe you're thinking that I will suggest some medications or something like that for the person to get.
Not medication, because I know some people were saying when it happens, you can do the old-fashioned steam. You put some vapor and steam.
I had that as option.
The ginger, the lime, that sort of thing, just to get a head start, basically.
Yeah, but doctor, and also, for example, if because I'm sure we all know that the corona does not have any cure for now. But for example, the symptoms that you have, you can cure them. For example, if you're feeling that you have headache, you can take a Tylenol just to ease on your headache, right? If you're coughing or you're having congestion on your chest, you can take your cough drops or your cough medication. So in curing those symptoms, you're helping yourself to cure the general pains that you're having. So I think that is something also that some doctors are recommending. What are you saying to that?
No. That is inappropriate. It's
Is
inappropriate. What you're saying is, like, for example, you have a wall that is dirty.
Yeah.
And because the wall is dirty, you want to get the dirt out of the wall.
Yeah.
You are saying you should put the paint there. The paint will be there to hide it, but it is not removing it. So if you have a symptom, for example, headache, you take paracetamol. You are taking the headache out, but the cause of the headache will remain there unless and until you get the cause of the headache out. So taking something to relieve the symptom is only relieving the symptom, but it's not treating the cause of the symptom, which I am discouraging. So the answer to
in that instance, doctor, sorry, Fatou.
Go ahead.
In that instance, like I said, you've called 1025. You've exhausted all these other avenues that you should be ringing.
Yeah.
You've got a terrible headache. You've got a cough. You don't know what you're doing. What should the individual do at that instant? Because you're panicking as well, because you're thinking you need to do something.
So with a terrible headache, he or she can take something to reduce medication, for example, to reduce the intensity of the pain. However, that shouldn't be the solution to the problem. This is what I am trying to discourage. I don't want people to see it like, because I cannot get access to the service, I need to take this medication and sit at home. That is what I am discouraging. So the medication could be used to relieve the person from the pain he or she is having. However, he or she should still make effort of getting to the service provider so that the service will be done. For example, you could have those symptoms and think that it is corona when it is not corona. It could be something else. Or you could have the symptoms and think it is something else when it is not that something else, but some other thing else. So, but if you get to the provider, he or she will be in the position to tell you what exactly it is. Get the cause, sorted out, and then the symptoms disappear. But, so I am this is a very important question, because I've seen many, people share on social media and elsewhere on stuff that you need to get at home and the like. And I thought this is an opportunity for me to say that is not acceptable.
It's right, of course. Yeah.
But also one thing that is also concerning for me is I saw this morning, someone was saying, yes, we have COVID in the Gambia. Don't forget that we are in the rainy season. We have a lot of malaria as well. So people should also be mindful. But my problem, doctor, is right now in our health facilities, most of the health practitioners are infected with the virus. And sometimes people get sick, they think it's normal malaria or something normal, and they're carrying the virus. They go to the hospital, they come in contact with these doctors, and they give them the virus. So the virus can be with you for days before even you manifest symptoms. So that is why I personally think it's very, very serious. You have to be really sick to visit the hospital nowadays, because you can go without a virus and come back home with the virus because you don't know who you're coming in contact with. So that's why I am personally not the one who will be visiting hospitals these days, because of these concerns. I was telling Mordunjai day before yesterday, I think it will be good if if the hospital is screening people before they get into the main hospital, like having a tent in front of the main facility. Whenever people come in, just do antibody test, or just simple temperature, just to check if they are okay to get into the main facility. I think that will also be important. But in the absence of that, would it be advisable just to walk into the hospital on a regular basis, just like we used to do? Things have changed, and as things change, we should also look at ways of how to protect ourselves.
Yeah, so I think the hospital management had done, exactly what you're talking about, in fact, at the beginning. And, the reaction to that was by them, reducing the electives that they do, stopping some clinics, open outpatient clinics, and also minimizing the number of hospital visits. Those are all reactionary measures to prevent nosocomial infection, that is infection gained from hospital. Yes, it is true that the doctor or the healthcare practitioner could get infected and give it to the patient, and not the patient giving it to the healthcare practitioner. But it is important for the people, the Gambians, to know that the hospital made that strategic measures well before the whole thing came up to this stage. And in doing so, they stopped some outpatient clinics. They minimize those, make long elective, appointments, and as well made measures in which they will limit the number of visits to the hospital. However, it is also the people's, responsibility to not frequent the hospital when there is no need. If you have headache, for example, and you live in Lamen, for example, and there is a health center in Lamen, it will be advisable for you to go to the health center in Lamen than going to Banjul, where everybody meets. So that should be an individual responsibility added to the responsibility that the authorities will have.
That I think that is true, Manyenya, because that's my concern. My grandmother loves to go to the hospital every month, and for those are because for some of those elderly people, they think they can only get help from the hospital. Even when you give them their prescriptions, they want to make sure they see the doctor. And now I think that's where maybe in the Gambia we should start introducing telemedicine, where the doctor can be in their office and talk to you whilst you're home. I think it's about time we introduce these technologies in our health facilities to be able to service our patients who are not able to visit the hospital at these times. But also now let's talk about the stigmatization. I have said earlier on, I had a patient that I was talking to. He was willing and ready to talk to us, and he wanted to share his story to empower other Gambians, so that people can definitely understand that this virus is real and is in the Gambia. And we set up, and he was with me. We did every test and everything, and I just mentioned to him, I think you should call. Did you call this particular person? And he said, oh no, I didn't. I said, yes, I'm a woman, and I know it will be good to check with your people. And unfortunately, that person was not comfortable. And it was not him, but it was the family member who was not comfortable. So it's important to make people understand that this virus is not is deadly, but it's not beyond anybody. As we speak, the vice president of the Gambia is infected with this virus. The Minister of Finance, the Minister of Petroleum, the Minister of Agriculture, and they have all come out, the Lord Mayor of KMC, they have all made their status known to Gambians. The Prime Minister of England was also infected, and he had come out and spoken to his people, to the entire world, about his experience. So I think it will be important for Gambians to know that, yes, it's a deadly disease and it's a new virus, something that nobody has got cure for, but coming out and talking about it will only help to empower our people at home, those people who don't believe that this virus exists.
Yeah, so that is also a very, very, very important question, and very important because if you observe at the beginning of the outbreak, it was social distancing that was being said. Everybody was talking about social distancing. All on a sudden, it changed from social distancing to physical distancing. This change of terminology is very important. I find it difficult to seeing people still saying social distancing. From my own point, it shouldn't be. It should have been retired. Why? Because social distancing, the word social distancing has affected a lot of people mentally. Like, the way I will interpret social distancing will be different from the way someone else will interpret social distancing that doesn't have an idea or a view or knowledge of what coronavirus is about. And this was suggested to the WHO. It led to the change of terminology from social distancing to physical distancing. Why? Because you could still socialize with people and not get the virus. But, in that sense, you could do the physical distancing, give, a distance to people and be socializing with people and not get the virus. But if you say social distancing, it means breaking the social chain between people. And that is not possible, because if you see that, like, if my family member gets the virus and WHO is telling me to social distance, it means I should cut all social ties with that person, which is not correct. So that's why now it is physical distancing. You could, socialize, do all kind of things, in as much as you are observing the precautionary measures. And the other important thing people need to understand is, disregard all that it comes with, the virus comes with. It is deadly, it causes, all kind of stuff. But it is not different from what malaria does. It is not different from what malnutrition does. It's not different from what HIV does. They are all diseases. They all, can lead to, mortality. But what is important is, if somebody has got the virus, it is of great importance for the family member specific to provide him or her the moral support, the mental courage for him or her to recover. And that is why I discourage as much as I can the terminology of social distancing. We should encourage the use of physical distancing. That is the most important and most accommodative terminology. Physical distancing. Your family member could have the disease. You be at Basse and he be at Banjul. You call him every day on the telephone. You are providing social support to the person and giving physical distance. So that is a way of changing the mentality and as well reducing the stigmatization of these people. Because when we maintain the issue of the terminology of social distancing, some will think that waruma, I'm a fair mom because I'm virus. Some are even telling me that I had someone saying that the virus is in the air, so bisa living very mutui muna dugasi, so you should be having the mask every. Those kind of thoughts. It's because you don't understand what exactly is happening. So we need to use the appropriate terminologies and as well, try to educate our people on the exact modalities or things that are happening regarding the virus.
Yeah.
Manyenya, so stigmatization.
So stigmatization is something that is very common within our society. Obviously, Gambia, we would stigmatize about everything. And I think it was very commendable for Talib to come out and show people, because what happens is, as soon as the WHO says social distancing, You shouldn't be visiting each other. Stay away from each other. Wash your hands. They made it so serious to the point whereby people like myself were thinking that, oh my God, okay, this is going to be worse than Ebola. We saw how people were dying, blood coming out of their ears and eyes, and they look so bad. And so if you have someone like Talib, he's got the symptoms, he's had his test done, he is positive, and he comes in front of us and starts talking, explaining that he's fine or whatever. I think that would sort of like give people a bit of a peace of mind that it's not what they think it is. And I think that we need to stop stigmatizing with regards to this, because if this is a virus, Bohamne, we need to know. You have to come out there and speak to people so they know what is going on. Your experience might be different from somebody else's experience, and that person can learn from that experience. So that needs to be done. We need to stop telling our people, no, hide. I understand, out of respect for certain people, if I'm your hamne, then bari kersa. Bugun lolu expose what people would say might affect them mentally, so they might not want that. I understand that, but I think if you're in the public eye, okay, ko hamne nekola in the public eye, I can understand. But if you're in the public eye, and this is happening to you, you need to come out and speak and let us know about it. Because those that are not in the public eye, that is a reassurance in its own. Because then you're gisne so this is not as bad as we think it was. Because man, the first time I heard about it and we had a lockdown here, I panicked. But then when I saw the Prime Minister come out, I was reassured. I thought, okay, this is not as bad as it seems. Then Amnyom Tom Hanks, Amnyom Idris Elba, all of these people started coming out, and you're thinking, okay, it's not as bad as it seems. So we need to have people coming out, and the stigmatization needs to just because there's no time for that right now. This is about life and death.
Yeah, and the coming out of people that have the virus, specifically the public figures, it is in itself psychotherapy, because it is giving psychological therapy to the many others that have the virus and feel very scared, or to the many others that will want to go do the test but feel scared of the positivity of the results. So if they see someone of a public figure like Talib, the Prime Minister, and the like, or someone like Chris Como, who appears on the new TV every day, having the virus, and come out and tell the whole world that I had the virus and I recovered. It is in itself psychotherapy, and also an encouragement for people to come out and do the test, which in itself as well is a means of like helping to overcome the effect that the virus will have on the people and the community.
Actually so dañ ko dee wasi olof ñu ne feebar boo ko nobee dafa gën a lii waaye boo ko feeñalee dafa wér sax. I think we should all take this approach towards lii feebar daal boo ko wonee dafa wér. So I think loolu is important for people to know. But also is am na ñoo xam ne, for example, I would encourage public figures to come out.
Absolutely, they have to. It's a duty. It has to be a duty for public figures. Other people, that's fine, but public figures need to come out when they've got it, explain to us what's going on, and reassure us, because as soon as you're a public figure, your private life doesn't become private. So we need to know. You need to reassure us. So I think that is very, very important.
That is important. So now let's talk about doctor, if you come in contact with somebody, or you're exposed to somebody who tests positive for the virus, should you request to get tested immediately, or do you have to isolate yourself? Because I keep asking people, what do you get when you, like, for example, if I have symptoms and or mild symptoms, and I'm not having breathing issues, why do I have to go to the treatment center? There's no cure for the virus. Should I isolate myself at home if I can? If you're able to isolate yourself, should you isolate yourself at home? Because what I saw, even in the US, when people were sick, what they were saying on TV was isolate yourself, because we cannot accommodate everybody. Isolate yourself. There's no cure. They were just telling you this is what you need to take. If you're having issues with your headache, just take some, headache medication, take some pain relievers and take that. But should we go to the hospital just because you come in contact with somebody who's you're exposed to somebody who's tested positive? What should we do?
No, no, because the virus has an incubation period.
Yeah.
The incubation period is like, the period in which it manifests itself in the person's body, in which when, you test the person, you could get the virus as to detect if the virus is present. And the incubation period runs about 2 weeks, that is 14 days. And this is why, you have people being quarantined for 14 days and the like, which I am not a supporter of. Why? Because I think, the issue of quarantine for a loan-dependent country like ours is too expensive. It's unsustainable. In healthcare, you talk about affordability and effectivity. It is not only about effectivity, but affordability and effectivity. What is more affordable and effective? Not what is effective and not affordable, and not what is affordable and not effective. So it's affordability and effectivity. So in that, as you said, in the US and elsewhere, people get in contact with those that they suspect as potential, cases, or those that have got the cases. What they do first is self-isolation. And that self-isolation is to provide an incubation period to see whether you'll manifest symptoms that will warrant you doing the test. So like what is happening in the Gambia, which to me is a waste of funds, is if someone comes from an area that is a high risk area, they quarantine the person for a period of 14 days. When we know that people could come from the United States and go to Gambia and not get the virus. But if you give the person 14 days of national funds in the form of quarantine and doesn't get the virus, it means it is a waste. But you could in another way say whoever comes from an at-risk area, when you come, you have to be self-isolated because we got your details, and then somebody will be there to check on you every morning or every day to know if you are self-isolating. That alone is much cost-effective than quarantine. So the answer is you don't just have to do the test right away because you got in contact with somebody that has got the infection. Nor does it mean that if you started manifesting symptoms, it means you get the virus. No. But another very important thing I want to make known is there are many people that do not have the symptoms, that we call the asymptomatic people, who get the virus and transmit the virus. And these are the people that are very, very important with regards to the issue of the pandemic, because these are the people that are infecting a lot of people in the community. They are the sources of community transmission. So it is on one side, you don't have to just go and do the test right away. But on the other side, you also have to be worried because you could get the infection if you do not test after the period of the incubation.
Okay. So it will be advisable to stay home and isolate on your own.
Yeah, self-isolate and minimize your interaction with people. Observe the precautionary measures, and as well, get mask if you have to be in close contact with people, and then you do that for a period of 14 days. That is the incubation period. If you do not manifest symptoms, but still think you want to do the test, you could go do the test after 14 days to see whether you got the virus or not. But if after 14 days you don't have the symptoms and you do not, think you are feeling anything different from being normal, then you're okay.
Yeah, and I think Manyenya, he touched on something that is very important. I had this conversation with the director of health promotion. Is the amount of money we the taxpayers are spending on quarantining, especially flight coming in from a commercial flight, most specifically St. Brussels. I mean, it's just unbelievable if you are having over 150 people coming in weekly, and we the taxpayers have to pay hotel accommodation 3,000 plus every night.
Wow.
We have to pay for their feeding, we have to pay for their hand sanitizers, we have to pay for everything. Based on my own calculation, it's close to $10 million is every single flight. Why are we doing that? In countries like Senegal, you try before you even board a flight. I know a family member who was supposed to come this Friday from the UK, and through via Senegal, he was returned home because he doesn't have his test results, and because he doesn't have authorization letter because he doesn't have a Senegalese or Gambian passport. So he needs to get an authorization letter from an embassy. Also, he needs to get a test result to get into Senegal. So once you get to Senegal, they will require to get your test certificate. If you are negative, they'll let you go. If you are positive, they'll tell you to go and self-isolate. If you don't have a result, they will test you on the ground at the airport. You wait for 4 to 5 hours, get your results, and they will tell if you are positive, they'll tell you to self-isolate. They will impose it on you. So that is more cost effective. The country is only pay, and you are paying for that test results also. Yeah, you are paying for the test kits as well. So that at the end of the day, they are not even spending anything on you. But us, a small country like us, we're quarantining everybody, whether you have symptoms or not. We don't. I don't know how we come up with that idea, but I've been told they're trying to discourage it now because they know it's not sustainable, and going forward they're working on changing that procedure. But I think that is something that is really really not cost effective for us as a country. That is why right now we cannot accommodate other people who have symptoms. I know of people, I told the other day, I know of people who need the services. They are still waiting to get a place to even get a test. So this is the issue, and I cannot agree with you more, doctor, that we should not be spending our resources on something like that. We have more pressing issues to deal with when it comes to COVID-19. Manyenya.
And so to add to what you are saying, like Senegal has RDT, rapid diagnostic test, that you could get tested, within a couple of hours, you get the results. Yeah. Gambia doesn't have that. So Gambia, I think they're doing the PCR, something like that. Yeah. So with that also is it adds to the delay of the results. But what Senegal is doing is what Gambia should do. Like at this moment in time, people will only travel or are expected to travel on only important missions. So if you have to travel on an important mission, it shouldn't be difficult for you to get a test done for you from where you're coming from. And let's take it, for example, the whole issue about the isolation and the quarantine is about, contact. So if everybody that has boarded the flight has got negative test results, what will be the essence of doing a quarantine or testing those people when the exposure there is all negative? So this is what Gambia should have done. Number one, they should have made sure that whichever flights comes into Gambia will only carry those that have got negative test results and proved on arrival. If you don't have, you go back. Number two, all those that have come with positive test results, you are taken straight to the treatment center. That will save us the cost of paying for quarantine. And number two, the amount of money we are spending, I call it wastage. The amount of money we are spending on quarantine could have been used on sensitization. The reason why people are in denial, the reason why people are not coming forward is because, number one, they are not well informed. Number two, they don't have no knowledge about it. Those that are not well informed, you cannot blame them. Those that don't have the knowledge, you cannot blame them, because it is the responsibility of the government and those responsible to provide them enough information to be able to decide well about the virus. So if we had spent the millions we are spending on quarantine, on sensitization, everybody in the Gambia from Katon to Koina would have got the least knowledge about COVID-19. And that will minimize the number of people in denial. But like on a preventive, like in public health, it is about community. Everything about public health is community. You give community the ownership of the intervention to make it easier. Like this case, they should have given the community the ownership, the people in the community. Every settlement in the Gambia you go to has got a social structure of leadership, whether it is Musu Kafo, Keba, or Kafu Keba, or whatever you call it. Those are the people the government should have used, or the national response team should have used as structures or agents of change, agents of sensitization. If you have a Kafu of 100 people who all listen to you and you are well informed about the virus, that 100 if it is not the whole 100 that will listen to you, at least 75 will agree with you. And if 75 agrees with you on the issue of coronavirus and follows the preventive measures, then it means you are minimizing the cost of transmission and at the same time minimizing the economic cost on the response mechanism. But this is not what we done. And this is where we had a lot of problem.
Yeah. My perspective would be slightly different because I want to focus on those travelers that have decided to leave one country to come to another. Mm-hmm. I know there would be different reasons. Of course, there are different reasons. Mm-hmm. But I think some of them might be, of course, you don't want to lose your ticket. You don't want to lose the money that you spent on it. And I know that there are airlines that are giving out vouchers. So when you do want to travel within a period of 6 months, you can book a flight and travel again. Yeah. Unnecessary travel should not be encouraged at all. Only travel when you know you have to. When you seriously have to travel, then you can travel. Because as a Gambian, like I said, we all have to take responsibility. The responsibility is not just to do with wash my hands, wear my mask, and isolate. No, but the responsibility also is, when you travel unnecessarily to Gambia, you're costing the taxpayers money, and that money as well that we just explained now could go to something more important. So why would you do that? Why would you travel? Why? What's the reason? Can't it wait? So I don't get to travel. Most of us had to come to Gambia. Most of us had very important things that we had to do in Gambia, but we had to cancel. You take your voucher and you wait for 6 months' time or whenever, and you reuse that voucher. These companies as well, SN Brussels don't care about Gambia. They're making their money. All they're going to do is bring the flight and then go again. So the government also needs to find a way where they're going to curb on this as well. So it is, we need to take responsibility. We definitely need to take responsibility. The government is going to do their bit, but we also have to do our bit. Like I said before, when we just started, life is not as we know it. It will not be as we knew it before. And we just need to make sure that we also help, towards what's going on. Traveling unnecessary for what?
Yeah,
what are you coming to Gambia for?
I do understand. Some travels are very essential, and some people will want to come in. But would it not be helpful also for government to put out a practical approach to this? Because obviously, my issue with, I have said this openly on several occasions, I do not believe we should close our economy because this virus is going to be with us for a long time. It's not going to be just here for 1 or 2 months. It's going to be here for a couple of months. That's why bigger democracies, bigger countries are slowly opening up their economy. Okay, you don't want to close your economy and the economy goes down, and your health infrastructure is definitely going to go down. Everything else goes down. So we're going to have to live with the virus. And air travels, especially in the Gambia, I'm sure you have seen the communique coming from ECOWAS that open the borders. And we have to open all borders. All ECOWAS borders should be open. Free trade. These are things because people are looking at the long-term effects of this virus. So, but people are doing it responsibly. Because,
absolutely,
for example, if we decide to have flights come in, why don't we require a test result for everybody that is coming to our country? Instead of getting these people to quarantine, get test results. When they come in, tell them to self-isolate for at least 5 days because they've been exposed. For example, in the US, people can go to the US right now with visas. You don't even have to be a citizen or a green card holder. You can go to the US with visas. But when you get to the US, they only allow flights that go direct flights because they don't want you to be exposed. That's why right now you cannot fly with SN Brussels to the US because you're going to have to stay in Brussels for some time. So they're only allowing flights that are going direct. What that is doing is limiting your exposure to different people. And that is one thing that they're doing. They're not quarantining people at the airport. But when you get there, they'll tell you, can you try to self-isolate? Senegal, our neighbors, that's what they're doing. They require you to have a test result. When you get to the airport, they will still, when that result is, you don't have a result, they will do a test on you. And when they do a test on you, when you are positive, you pay for that test that the country is doing for you. And once you pay for it, when the results come negative, you're allowed to go. When it comes positive, they'll advise you go on isolation. But if you want to quarantine everybody that comes through the air, that comes through the borders, that comes through every port in this country, that makes it very difficult. That's why we are spending millions and millions of money on quarantine. And then we are losing ground on in the fight against local transfers. That is what is happening right now. That is what is happening, because a lot of people, we are not, even the contact tracing is difficult, because I know people who tested positive and they live with people. Their results came before they were picked up. Before they were picked up, they spent 2 days in their homes. Those people are not being quarantined now because they don't have the space for all of that. So these are trying times for the government, but I also know we need to strategize and change our ways of doing things right now, because unless we do that, it's going to be difficult, because we cannot just quarantine everybody, and we're
No,
spending millions. And yeah.
Yeah,
no,
I,
we can't do
I, I think our national response team made the very mistake on the right from the beginning on the strategy that they use all over the world. If you follow majority of the countries, the United States, for example,
Yeah.
the two main strategies that were used were sensitization and testing. Sensitization and testing plus political will. Sensitization, because you cannot test all people, when they don't know about the virus. It is in knowing that they will come out to get the test done. And testing as a strategy, because it is only in testing that you could separate those that are infected from those that are not infected. And it is in doing so, that's why, Italy was able to get to the peak of the curve. That's why South Korea did well. That's why every other country that has registered improvement did well, because they provided enough information to as many citizens as possible, and also tried as much as possible to test as many as they can to minimize the number of those that are infected in the community, because the virus, or getting to the peak of the curve, is to reduce the incidence. You cannot reduce the incidence without getting people tested. And in reducing the incidence, you reduce the prevalence of the disease. That is those that are new and those that are old. But you cannot do that without testing. And you cannot do the testing without giving people the information. So it is a chain. You get people informed of what is happening. And then if they are informed, then you move on to screening and testing them. When you test, then you know those that are having the virus as the incidence. And then, you minimize the number of those having the virus as in minimizing the incidence. And with time, you minimize the prevalence, and this is how the curve comes down. But the Gambia was not doing that. Like going to the radio, how many people have the money to buy battery for the radio in rural Gambia? How many people have the time to go listen to the radio in rural Gambia? Only a few people have that. There are people that will struggle to get $50 for a day. So, but they could have used, I said it many times. I said, our country is, blessed in quote, to be a spiritually indoctrinated country. Spiritually indoctrinated in the sense that a lot of our people listen to their religious leaders.
Yeah.
And in public health intervention, it is very important to know the strength of the community so that you could know how to approach the needs of the community. The strength of our community in Gambia as a community, for example, is we've got people that are so connected to their religious leaders. And how can we use the religious leaders to maximize our sensitization measures? It is by making sure that the imams, everybody talks about coronavirus at the beginning and at the end of their sermons. The pastors does the same thing. It means you are making the people hear it every day. So that is minimizing the cost on the government or on the people responsible, and at the same time maximizing the sensitivity, because you are sending the message very far. If, for example, this religious leader sends WhatsApp audios every day, and at the beginning of it, he starts with coronavirus. At the end of it, he starts with coronavirus. Who knows where it is going to end? Maybe it gets to Fatou. it gets to Koina. And the people in Koina are every day hearing the Imam talking about coronavirus.
Can
And,
I come in
at the
here?
beginning and at the end.
Can I
So
come
it is
in
going to
here?
help.
Doctor, most of our religious leaders don't believe in this coronavirus.
No, but you know why?
But because sometimes, yes, because the truth is, you remember when the government imposed the SOE, right? And the churches and the mosque were all closed. There was a backlash from religious leaders. Why should we close the house of God? Why should we? And this is why I have said this. I think this is why up to now, even with the current SOE, right? The mosques are open. The churches are open because they are scared of the backlash that is going to come in. But unless and until we are ready to confront these things, because we can pray in our individual homes.
Yeah, but this is why I said. This
Yes.
is why I said. This is why I said.
That's the
public.
fact.
This is why I said
Most
public
of them,
health
not all of
interventions.
them. Yep.
Yeah, this is why I said public health interventions are community-owned interventions. They belong to the community. If you want a successful intervention, make it transfer the ownership to the community. In transferring the ownership to the community, it means you engage the community on the activities of the thing. Like, for example, you cannot come from Banjul. Banjul, Basore, like you don't have to go out. But if they see somebody from Basore as part of it that is doing, say, hey, carrying model, who is that carry? He's part of them. He is part of them. So it means it is ownership. So you cannot like take people, like say, for example, the director of health promotion goes to Bashe where they don't know him. And he talks about corona only if you will listen to him. But if he uses a dweller of Bashe as part of the mechanism or the sensitization mechanism, you will see that person are not him. And seeing that person means they're taking ownership of the thing. I give you an example. In Sierra Leone, when Ebola came, they had a problem. The Muslim community had a problem because a lot of the people, the disease were infecting the members of the community in the process, the ritual process. And the WHO had a lot of problems with that. But they overcome that problem by engaging the community, making the community part of it. And in that, they include community members, religious leaders in the ritual process, in which they will do their ritual process or procedures without being infected. And that helped. Why can't Gambia do that? If the community is resistant to it, use a member of the community to be part of the response team, to be part of the change makers, and they will accept. This is what I have been advocating for. We need to hand over the only way we could do this is preventive measures, not other means, preventive measures. And we can only prevent the virus when we hand the intervention to the community, not giving them everything, but making them part and parcel of the thing. Put an imam there, put a pastor there, put a comedian, a musician, whatever there, whom they deal with these people in community every day. They will listen.
Yep, I think that is true, Manyenya.
Yeah, I agree. Absolutely, I agree. I think if you open a new door, it's just got to the point where we just need to I don't even know, doctor, what now we know where it's at. What do we do now? What do we do as citizens? What advice would you give to the people, the doctors and nurses and the first responders out there? Is there hope?
Yeah, of course there is. Of course there is hope. Like the military man never gives up in the battlefield unless and until he dies or he wins the victory. Yeah. So there is nothing like giving up. And the only way right now is, from my own personal point of view, is a return to the drawing board and make sure that where we had lapses in, we fill those holes and do it in a way that many other countries are doing it. We cannot and must not copy and paste what is done elsewhere. Like the issue of face mask. I raise questions about the issue of face mask. I and you could afford 10 face masks, but there are lots of people who cannot afford the face mask. What is government doing to provide those people face masks? What is government doing to provide those people face masks?
Government is imposing $1,000 on anybody who's not wearing a face mask.
That they're not providing.
That they're not providing. I have
so this is
I have a family, you have a family of 10, 15
Wow.
people.
Yeah.
And every face mask is costing $50. 10 by 50, that's 500. That is your 1 week fish money. You think you will use that to buy face mask?
That's exactly
So
what
that
we're
is
talking about.
that is one.
Yeah.
So that is number one problem. Number two problem is the
Yeah.
issue of lockdown we were talking about. You know, this is also another copy and paste mechanism that the government use. WHO gives out, you know, protocols or ways of overcoming, you know, or implementing your response
Doctor,
measures.
you're breaking.
And it is
Doctor,
left on individual countries.
Doctor, you're
to,
breaking.
yes. So the WHO gives a protocol of what to do, and it is left for individual nations to see how they could, you know, adjust the response to what fits them. And you know, I had a problem with, you know, the issue of lockdown. I don't know, but I tend to believe that the people mistaking lockdown, state of public emergency as a lockdown, which is different. The state of public emergency is not a lockdown, and nor is a lockdown a state of public emergency in totality, but it is a subset of state of public emergency. The state of public emergency is more or less a response to give government or the executive the power to restrict people from movement, to restrict people from doing some other activities. And the lockdown is, you know, kind of, you know, to close people, put deadline. You cannot do that for a country like Gambia. And this is where we had the problem. People think the state of public emergency helped. It didn't help. Why? Because you cannot tell somebody who is living from hand to mouth. 80 to 90% of our people live from hand to mouth. If you tell them to sit at home and you don't give them what they will feed on, they will find other means to go out. And that other means of going out is where they will get infected.
Yeah.
So that is where the problem came from. So what government should have done, you know, like a lot of countries in Europe, Eastern, Western Europe, they didn't get locked down. They use mechanisms to restrict people. They don't have complete lockdown like, you know, we were doing. And in fact, those that have the lockdown, they provided alternative measures. If I tell you to sit at home, I give you something that will sustain you at home to make you not go out. But you cannot tell someone with 10 family members who has, you know, at least 5 kilos of rice to cook every day, needs 5 kilos to cook every day, to sit at home without getting the money to get that rice. How will that person live? He or she will find another means, and that finding of another means is where they will get infected. So what the government should have done, I would have preferred government to get a loan if they don't have money. They could have got a loan. That is, you know, a good way, an acceptable, you know, measure. Get a loan. Give every Gambian $2,000. Nelene can do Gina for 4 weeks. Everybody will get $2,000. Can do Gina. And in that process of 4 weeks, nobody going out, they build robust structures that will make sure that everybody, you know, is informed. Every leader in the community has the knowledge, so that the time you allow them to come out, then, you know, people are already equipped that will maintain them and then make sure that the things are not done. And that is the essence of state of public emergency, is to give time to the community or to the people responsible to build their strength in response to what is coming. And the Gambia had the time. We had 3 good months of grace period to do all that we could have done before the virus came to Gambia. What were we doing?
Giving rice.
Yeah. And you know, the rice, even the rice is not helpful. You cannot give me, it's a money bottle, you don't give me fish, you don't give me meat. How will I eat that? So this is the problem. So we need to go back to the drawing board. We don't have to give up.
Our situation is very critical. Our situation is very, very delicate. I am that person who does not believe in the lockdown, because I kept asking myself, am I able to provide food for myself and my family for that period? Who else is able to do that? Not many Gambians can do that. But again, you look at it, okay, maybe if we lock down for a week or 2, we can regroup. But if in that period, what will the government do? We need to know they are locking us down to do something. We had SOPs for how many times? How many times did we have SOPs? So SOE, I kept on saying SOP, SOE. We have a state of emergency so many different times. What did we do? What did we do?
I think the government needs to answer that.
Yeah, so that becomes the issue. I mean, state of emergency is to give you time to prepare. And what I've seen in other countries, I was talking to somebody in the UN system he's a Gambian, and he said to me, Kenya is taking advantage of this virus. We have built 3 hospitals for Kenya. These are facilities that they're using now for their treatment centers. I have not seen any treatment center that was built during this virus. Countries are taking advantage. This is the hard fact. I haven't seen one facility that was built. I know the Dambell clinic was being refurbished by TAF and the ministry. Apart from that, I have not seen any facility that has been built. MRC has a capacity of what? 32 to 35 beds. And the treatment center that I visited at the Wencho has about 10 beds. That is 40 something. How many ICU beds do we have at the RVTH?
You know what?
I think it used to be like 20. I think it's 20 beds.
We are talking about less than 100. We're talking about less than 100. And this is the problem. That's why we're using every single hotel in this country. So,
and if you look at other places, like when it happened in China, in 7 days they built, or 3 days they built a hospital or whatever, things like that were happening. In the UK, when it started peaking, what they were doing is they were using like whatever centers. There's a center here where they do like trading. People come from different parts of the world to come and exhibit their stuff. They changed that within 2 weeks or a week or whatever. They changed it into a hospital. Aren't there government buildings that they can change to accommodate what is going on at the moment temporarily? Can't they do that? They should be able to do that. When you bring us a budget and you show us 500 million Dalasi, and over 2 million Dalasi is spent on what? Transportation and whatever else. It's just a joke. And it is a terrible and a very tragic joke. Because that is not what Gambia needed. You come and you show us ambulances. Okay, fine, bravo. So what are we going to do? Transport people to where? You take people who are infected with COVID and take them to the RVTH, and you don't have I'm not a medical expert. Why I know you can't. And there are other people who are attending hospital because they have other illnesses, diabetes, heart disease, or whatever else. COVID, you're going to kill that individual. So we need to isolate. We need centers that are isolated from those hospitals where we can take these people. Why centers you have I-32 whatever need? That is a joke. You're talking about 500 million Dalasi. We could have done something. I think we had a head start, and I think we saw the money and not what we had to do with the money. That's exactly what happened. And unfortunately, I'm sorry, I'm not a political person, government. I don't sit there and start talking about my government this, my government that. But I am a concerned citizen, and it's what we see. And plus, if you're not coming out to let us know what is going on, trust me, we will assume, we will just make things up. We will say whatever we want to say because you're not telling us. You have to be honest with us, so we know what's happening. But nobody is saying anything. Nobody is coming out or saying nothing whatsoever. Who's ruling? Dr. Samatelegi, he's sick. Yeah? Well, he's not sick yet, but he's done a test and we're waiting to hear what happens. And he was the guy who used to come out once in a while and let us know what's going on. Now, Gambia doesn't even have that.
Even right now, because the president has given him all the powers he's been given the powers to declare state of emergencies, medical emergencies, and all this. So my worry is now that he's at a treatment center, who's leading the fight against COVID-19 in the Gambia?
Facebook, WhatsApp.
In the health, the healthcare system is structured. So in the absence of I think in the absence of the minister, he has got personnel that are there holding away. Like for example,
the permanent secretary.
For example, even the director of health services could act in his position because from an administrative point of view, the director of health services is more or less the head of the ministry, because he is the head of all the health services of the Gambia. The minister is a policy maker, like the permanent secretary and the like, but the director is the overall head of all this. So in the absence of the minister, the director of health services
and I can tell you the director of health services is doing well. He's tested negative and he's doing well. So thank God. Dr.
Yeah, so that is fine. So, but the other thing I like what you said about, the building of a center in Kenya. Even Ghana had, a treatment center built in 90 to 93 days. But the problem with our country is we so much believe in short-term, interventions or short-term things. We need to change. We need to change from short-term to long-term. Now COVID had, come, and COVID had, is hitting us hard. What do we do in case something similar comes tomorrow that we will already be prepared?
Yeah.
Do we have to get an infectious disease center right now? That tomorrow, if something else comes, we will not be worried about quarantine, centers. We will not be worried about isolation centers. We will not be worried about test centers, because that would have already been in place. Are we thinking about, providing training for infectious disease personnel, specialists, that tomorrow when it comes up, we will not think about, hey, calling for people for help? Are we thinking about, building, structures or building institutions where people will train, rapid diagnostic, test development? These are things that we need to think about now. And these are the things the coronavirus has come, in my point of view, to make the world think about the long term, not the short term. The long term and not the short term. But once we depend on short term, like it comes this way, we react this way, it comes that way, we react that way, we'll continue being reactive. Yeah. We'll continue be, that reactionary type of thing. Let us work on long term. Build treatment centers, train people that will man those treatment centers, that will not need foreign support. Train people that will develop rapid diagnostic tests. I was doing a study for the AU on the response mechanism used by the member states of the African Union. But it's very unfortunate to learn that there's nothing like a mobile, tracking app for coronavirus, which is very simple to do. The people with the technological knowledge could do that. That somebody could have an app in Basse and just like Facebook, go onto the app and know everything about coronavirus, where the treatment center is, how many people are infected, how many people recovered, how many people died, where is the treatment located at, how can the isolation be done, how long will you wait for the treatment? It is easy to do, and that is part of development. It is technological development. Why are we not getting that? I asked over a month or so, I couldn't get anyone that had developed one for that. And this would have helped us. This would have helped the money that will be spent on sensitizers, sending people to Basse. When there is an app that they could use to know the knowledge, information that is available, to know the persons that, to contact when there is need, to know the people that are infected. So technology, we need to take good, make good use of the technology that is available, and work on long-term measures. That is what is going to help our country, particularly the healthcare sector. Long-term measures. Train people. There are so many Gambian doctors in Gambia. What is, Sister Dambell doing to help, the healthcare sector? Maybe Sister, Dambell knows someone in the UK who is a professor of, medicine or whatever, who is, like have influence on the training there. Could she use that, knowledge or that interaction or that, relationship she has with the person to influence the training of someone in Gambia? Could Fatou do the same? Could I do the same? Could someone else do the same? What do you think if we all do that will, be the results in 5 years, in 10 years? Huge changes. So these are the things we need to do. Invest on long-term measures. Invest on long-term measures. At least tomorrow, someone else, like, maybe a health journalist will come and interview me, or someone else. I'm not Fatou. That is not a health journalist. Obviously. But that is all about providing the measures.
Yeah.
Yeah. So those are the things we need to do.
They need to do. And also, I want us to talk about testing. Out of 2 million people, less than 7,000 people have been tested. And we are worried about the numbers right now that are coming in. But I don't know what percentage is even that. Out of 2 million people, only 6,000 and change have been tested.
Yeah,
Is that,
so
what's your take on
so
that?
yeah, so that is very unfortunate. I made a rough, statistical, presentation of what is happening. Like 6,000 is being tested according
Yeah,
to Mr. Jai. And
yeah.
if 6,000 was tested out of 2 million, that is less than 0.005% of the Gambian population is being tested for COVID. Less than 0.005.
Wow.
And if less than 0.005 is tested, out of that amount, 0.112
It's,
or 0.113 had a positive test. So it means we are talking about 99.995 are not tested yet. 99.995 of our population are not tested yet. How many of that 99.995 have got the infection? How many of them have interacted with many people? How many of them will be tested and positive? And if you look at that way, you could also make a projection. If, for example, 99.995 don't get the test yet, if every 5% of that gets the test and 10% of that 5% gets positive, how many will we have in a month? How many will we have in 2 months? How many will we have in 3 months? That's why I said from the beginning, we are not yet to even the mid of the curve.
are we doing it the Trump way?
So
Trump
if you
said,
look at what we are doing, so what we
yeah,
need to, like the US, at
yeah,
the beginning, the US was not doing, huge number of tests. But
testing,
when
yeah.
they started increasing the test, they started climbing up the curve. And that
Mm,
climbing of the curve is good for them because it's
yeah.
going to, is good for us because it's going to isolate as many positive as possible. And in doing so, we are getting those that are not infected away and minimizing the chain of transmission. But like the rate that we are going with right now, it means we are exposing more than we are, removing the exposure.
Hmm.
Testing 0.005 is nothing yet.
Wow, that is scary though. That is scary. That
But
means
that is the reality.
that's the reality. I mean, that was I don't know. I have nothing to say to that. That is really scary because if
5,
0.005 is what is
less than
tested,
that.
less than that is what is tested. So many people are walking in the streets with the virus and they are transmitting it to other people unknowingly. By the time we test more people, the rate would be very, very high. What should be the solution? Mass testing or what?
Yeah, so now what we need to do now is, like I said before, we need to make sure that we test as many people as possible. And the way we could do is to decentralize the testing centers.
Yeah.
Decentralize the testing centers. No one has to come from Birkama to Banjul to get the test done. No
Mhm.
one should leave Basse to Farafenye to get the testing done. Decentralize the testing centers so that it will be, easily accessible to people. Some may want to get tested, but because
Mhm.
of the distance and the cost of applying that long distance, they feel reluctant to go. But if
Mhm.
like it is available for them at Basse, they could go to Basse and go to Banjul or go to somewhere else.
Yeah.
So decentralizing the testing centers is going to be helpful. And also decentralizing the isolation and quarantine centers is also going to minimize the cost on our healthcare system because that will make people reduce the mobility that people will have to move from
From.
wherever they are to another place. And in addition to that, they need to increase the rate of sensitization and as well make the government has a role. And that is the political will. One of the things that we have here as a problem is the political will. And
Yeah.
following the news, you hear people complaining about it every time. So the government has a very important responsibility, and that is the political will. They need to pump as much funds as possible on sensitization and testing.
Yeah.
As much funds as possible on sensitization and testing. Let
Testing.
every major and minor health center be a center of testing. Every place be a center of testing. And then if we do that, we will be able to get as many cases as possible. And the more we get, the more we climb the curve. And the more we climb the curve, the easier we get to the peak of the curve.
But then we don't also want to use all our test kits now and don't have any in store because I don't think we have that much test kits, because I know the Chinese gave us 10,000 kits that came in, and after that, how many more test kits do we have? So that also might be a constraint. The number of test kits we have in the country might be a constraint as well. Would you think that might the reason that might be the reason why we are slowing down on testing?
Or possibly people are shying away from going to get tested because they don't want to know. Possibly that's the situation as well. How many people are voluntarily going into these test centers to get tested?
Yeah, I saw the Prince Abubakar Sankano updated last night that the COVID the Ndemban clinic that was being refurbished by TAF will start testing this week. So that's going to be a center for testing, and they're going to start as early as this week. So that is something that is
good
very,
news, yeah.
very good news. And also, Monyenya did say that they are going to have testing. MRC Basse will have a testing center, and he did mention that I think all the regions they're going to put up testing centers in all the regions so that people don't have to come here. And also, they're going to have people in those places where when they take samples they can treat them there instead of bringing it to
that is decentralization, just like the US is doing, like governors of states taking ownership of or responsibility of the thing. It should be the same, because the Gambia is like commendable that we have regional health directories in all the regions. So those directories should be able to be centers or people that will take charge of the whole response mechanism. And then the central coordinating body could be at Banjul, but the regions will have their own where they will do the testing, screening, sensitization, and stuff like that. And the regional governors will act as, the president in those, regions. That will be helpful.
Yeah. So one thing that Manyenya, one thing that I am very, very worried about is the mask that we wear. So this morning I was because we did have some personalized masks for everybody that work with us, but so I needed to order some more, and I was concerned as to who to order this mask from, because you don't know who is sick right now. That person you're ordering the mask from, the person who is doing, because somebody will show it, the other person will all the, it might go through 3 to 4 people before it gets to you. And then who knows, the person that is doing the mask for you is either infected and not knowing it, then that becomes a problem. How should we know? How can we know where to get the proper mask? People that are to make sure. I called Bintu this morning. I said, Bintu, I want mask. How safe is your center? Because I just want to make sure. And she was laughing and she gave me assurance. I think
they are quite safe.
They're quite safe, but everybody should be asking these questions, because I find and I visited their center. We did film it. It's very, very secure, and it's
very secure. They've done it really
properly.
well.
They are putting all the measures in place, and even the people that they are there, they are testing their temperatures and all the stuff. So I was amazed with all of that. I do know that my team visited them, and we filmed the entire place.
And the location as well. Is the building they used. Is it Aisha Mary Cinema?
Yeah.
That's what they converted, and they've put like machines and the 2-meter social distancing. Everyone is wearing a mask, and they've done it really, really well.
They did it very well, and I think this is what everyone should be doing. People should be doing stuff like this. And when you call people, make sure you just ask the right questions. That's why I call the people that you trust, and when you call them, just ask the right questions so that you and your family are safe. That's why I'm recommending people to call Bintu and her team.
The COVID is it the COVID Gambia page? If you go on,
if you go on the COVID Gambia page,
they're sensitizing people as well, and
they're doing an amazing job sensitizing people, and they're also practicing maximum care to make sure. So I think that is very important for people.
It's important, but I wanted your viewers to know that the Gambia has got a Gambia Standard Bureau, and the Gambia Standard Bureau is the national body responsible for the setting of standards. Specifically, with this current pandemic, they are the ones responsible for the review of standard, procedures and mechanisms that the persons making the mask follow, and they inspect. It is through their certification that you get the green light to make a mask. So in that, I tend to believe all those that are making the mask went through the inspection by the Gambia Standard Bureau and got the certification.
Not all of that. I meet with people in the streets. They are holding masks like this. The Wajai mask. I'm like,
so those so that one should be. So that one should be a responsibility of that one should be a
I think we
responsibility
should
of the national.
Every
it should
individual.
be the responsibility of the Department of Public Health. Just like the way they discourage people from selling food on the streets and the like. It's the same way they should discourage the selling of masks on the streets like that, because it is about prevention. So in preventing, we need to apply measures that will prevent that transmission. Like the one holding the mask on the street may be infected and sell you the infected mask. You get it and then you give it to someone else. So the Public Health Directorate should look into that. Limit the number of people selling masks or producing masks, and also discourage the selling of masks on the streets. That is very important. And also, and the most important thing is government should, like I don't know, but I encourage people using this. The surgical mask. I encourage people using this because this is very, this is standard limit, and the procedures of making it is being standardized. That is those that can afford it. Those that can afford
there
it,
are some people, because that's what I was going to say, that in the Gambia, obviously, there are certain people who can't afford to buy that type of mask. And the only thing that they can depend on is the mask that is being produced.
How available is that even available apart from the medical health officials? Is it even available for sale?
I think it should be available. It should be ordered just like the other medications.
Okay.
It should be ordered. But another thing, because we're talking about masks as well, I saw this very helpful video that's going around, and it's by Ifinyasi, and I think she did it in Wolof. And she was explaining exactly how we need to use the mask, and I think that was very helpful as well. So people need to make sure that they know how to use their masks. It's not like nganyipsi, then sa brother or sister buga gina, mask, and then come back. You can't share your mask. So we need to, like I said, sensitize. Let's make sure that we're also updating ourselves, watching these videos, so we know what we're doing. It's good enough that you've got the mask, but you also need to know how you're supposed to wear it and take it off as well, so you don't get infected in the process.
So that is very important. So I want to make a little demonstration. Like this mask I have here is a surgical mask, and the surgical mask has this the upper part and the lower part. How you differentiate the upper part is the upper part has something sort of a metal string up here. The essence of this is to make it stick onto your the upper part of your nostril. So the inner part, the blue part here, is the inner part that you don't have to touch, because that is where that side should be as sterile as possible. The outer part is where the infection and everything should stop at. So like, for example, ngasol must be infect and then you put it up here. It means you are just giving yourself the infection. So the inner part should be as sterile as possible. That is the blue part, should be as sterile as possible. And when you put the mask up here, the essence of the mask is to cover your nose and your mouth. So when you put the mask, it should be above your nostril, like that. When you put it like that, to prevent it from falling down, you could just, press in here. It will hold your nostril. So you could even run with it. It is not going to fall down.
Okay.
Like when you press this, it will go off. You could, pull it up and then you get it down. But and then also, like every time, that is not correct. You put it like this, you leave your nose out, that is not correct. You put it under your chin, that is not correct. The essence is for it to cover both your mouth and your nose, because you are preventing yourself from inhaling respiratory droplets. So in doing that, you don't have to get your nose out. And the other thing I had people complaining about is that mask is that medicinal again. Yes, it will give you discomfort because it's something that you are not used to wearing, but it doesn't affect your your oxygen saturation. People use this for many hours to do operations. It doesn't affect your oxygen saturation. Yeah. The only thing I recommend is like like you feel uncomfortable with it. When you use it for a period, let's say an hour, 2 hours, 3 hours, and you feel uncomfortable, you could take a break where you will not be at a point of exposure. You take a break without a mask, get some air and the like, and then when you back to where potential exposure is, you put it back on. So that is very important. The mask is very, very important. And the other thing I almost forgot is that it is more important and more vital for those that have got, underlying medical conditions. Use than those that are immunocompetent. Okay. So that is very important because I got some questions about whether you could use a certificate to exempt you from mask and stuff like that. Lolo waruta neka exemption.
So nekk si kër gi nag nga nekk si kër gi da nga buga nekk si kër gi, do you have to wear a mask all the time?
Yeah, so that is also a very important question because I had somebody, someone asked me about a confrontation, he and she, two of them, he and she had with the police on the way, part of this. But I think the national response team need to make it clear to those enforcing the law that for them to understand that a mask is a preventive measure against potential exposure. For example, do man neka suma bir moto man kena and then have to wear the mask when I don't have exposure with it. Or I cannot be at home where all of us are not infected. Or matog at suma family we got tested negative and the like and say come carrying your mask. Everybody should be on mask. Even if I am in my bedroom, I should have. That is not the essence of the mask is to prevent potential exposure to the virus. And the potential places of exposure are where crowds are, where gatherings, large gatherings are, where you meet with people that you don't know, people that you don't know whether they've got tested or not, people that you don't know whether they are sick or not. That is where you have to use the mask as much as you can. And it is why it has been discouraged. The gatherings are, the reason why we are using masks now is because we cannot get rid of gatherings. If we can get rid of gatherings completely, we don't need to use masks. Yeah. But because we cannot get rid of gatherings, we will get into places where there are a large number of people. That's why mask wearing is encouraged. So if you are not at a point of exposure, you don't have to wear the mask. But that is not an excuse to say that I don't have to wear it. Okay. And before you go finally, Manyenya, deka bi nak bari na xew. Deka bi bari na xew. Wow. Monday last week, the magina did gis like the car cannot even move. Munga face ñu ne ñu nga xew ñu ñaa nga sanse di solu mané man ndax man benen dëkk laa dëkka ndax dëkk bi fi boor bi moom corona amu fi nit ñaa ngi xew nit ñaa ngi pati nit ñaa ngi def gis naa sax ay mass pool party gis naa yëpp gis naa ko. What do we have to tell these people pour ñu understand ne feebar bi is in the Gambia and gathering moy nonam bu mag ci moy number one noni febar bi. What do you have to tell these people?
Man, what I think is my personal view, you see, is that dafa am nit yo xamne they have someone that they would listen to. Back yo mun nañ fe tok ba elek and we can speak about it and say how dangerous it is. Doctor bi mun na ñew indi evidence am bi tek ko fi indil ñu ben long bo xamne hi na COVID-19 bi moko infect or no whatever. Be as drastic as possible and people won't still listen because you know why? Yeah. Nini, they look up to their governments, especially in Africa. You understand? Yeah. They would want to hear from those people to come out and always telling them, reiterating and telling them how dangerous this is, how infectious and contagious this is, and they will take it seriously. Yeah. But if your government is not coming out and speaking to its people and explaining to them what's happening, updating them, right? do you think people are going to take anything seriously? Because Fatou today moko wax nguur gi waxa ngut di nguur gi waxa ngut. That's what they always say. Nguur gi waxa ngut. So nguur gi ñoo war a génna.
Why nguur gi wax na di Manyenya kan mo
ñu tamit ñu tek ci baat. You understand?
Manyenya Ministry of Health ñu ngi wax yow every day di kan nga bëgg ñu wax.
Mane they have to people come out every day nañ génna. Every day the Ministry of Health they génna. Every single day.
What she's saying is very true and it's very important. Why? Because look at the United States, for example. How many times have they been calling the president to wear a mask? Why? Because he should be an example to society.
Yeah. Absolutely.
So the Ngur should be an example to the society.
Yeah.
And I've said, like, the ministry have been having, like briefing. That briefing, only a minute section of our country get the knowledge message, because many of them don't understand English. How are they going to get, the information? So it has to be, the communication should be in a way that they will understand. But the other thing Fatou said about, how the party, club thing, I think that is a policy, failure. Why? Because if you look at, countries, majority of the countries had, they have measures they reacted with regard to the virus in different ways. They had a medical reactory measure. They have a policy like a trade reactive measure and the like. So for me, I think in the Gambia we had a problem with that measure. Like, we know the club owners pay tax, then they pay tax. They have people they employ that they have to pay and all the stuff. What I think the government should have done right from the beginning was what the many other countries like Germany did, a reduction of tax. They should have told the club owners, yes, during this period of time, we want you to close your clubs, but there are two alternatives. One, either then you want to send tax bolena every day or every month, whatever it is, for this period of time. Oh, then you your loan to pandemic recover and buffer. That is a way to encourage them to close. But you cannot tell them to close when they are paying tax at the end of the month, when they have people they employ to pay at the end of the month, when there is nothing coming from government that will assure them that this is how we're going to help you. Like the US gives stimulus. The reason why they give the stimulus to us, the reason why they give an unemployment benefit to those that are not working is because they want them to stay at home. They cannot just tell them to stay at home without giving them that. So the government should have been in the position to do that, to tell the club owners, the small business owners, we are going to reduce the tax you pay by certain percentage for the reason, for the cost of you closing your businesses. That is to tell them that, yes, they are not talk home, but you're not going to lose completely. You will have a reduction. Or we're going to give you, let's say, loans, small loans to help you recover. The same thing with the drivers and the like, but that didn't happen. They just declare state of public emergency in your toxic area. You don't even do that. How are they going to do that? How are they going to cope?
Absolutely.
So these are the problems. So there should have been, they should have a task force of all stakeholders, important stakeholders, the person that will develop very important health policies on how to do, about these things. A person that will talk about a trade policy. How many import fuel? Like, we're going to reduce the cost of the tax on the fuel so that the person also reduce the cost of fuel for the drivers to reduce the capacity of their vehicles. The trade policy expert will come up with that policy. The security policy expert will come up with a policy that will help implement the measures or policies that are coming up in a way that will not affect the people and at the same time improve our mechanism of reaction to this. The same thing with the economic policy expert. What do we have to do to give to the people for them to stay at home? Nothing $2,000 for every 6 months, or then $1,000 for every 3 months. The economic expert should have that policy in place. And this is how all countries doing well. That is what they did. They didn't just go up there and come this way. They sat down and made strategic policies that suit the need. You see, people are wondering how the US came about 1,200. That is the basic standard average an individual will have minimum at the end of the month.
Yeah,
that's why they came up with 1,200. Who did that? The people that have the knowledge. Gambia has that. So it is not late. Muneño delu back to the
Is
drawing
it
board and do
because
that.
amuñ xaalis pour def ko docteur ndax? Because ñun dëkk
You,
bi dafa
you mean the Gambia don't have money to give 2,000 to every Gambian? Of course we have. The
I
money
think
we
it was a
spend on
rhetorical question.
the money we spend on quarantine center could have given 2,500 to every Gambian.
Absolutely.
It could.
Also, I think Manyenya, I'm not lumfi wa mang don't joke about it, but I think it's important pour xeex bi mu am fayda pour nit ñi gëm ko. It takes leaders in ñu génn si. Because man time boobu New York, when New York was going through this, New York moo fi gënoon a hit in the US. The governor Governor Como, every single day like they said and briefing him. Pila they said and every day briefing him. Because set and CNN the live stream Momtam page and Twitter page and Facebook, all media houses the call Lee. He became the darling. America yip jail ko because the for one in leadership. Seetal tay New York ak nu mo bari nit. Seetal num steady. Even though federal government when you don't push pour ñu ubbi seen economy dafa bañ. He wants to follow mom. Experts.
Absolutely.
Then su seetee most Republican state ñoo xam ne dañ toppa federal government ñu ubbi tey ñoom ñoo nekk di am surge because they refuse to follow the guidelines of scientists liñ leen wax. So loolu tam dafa am solo leaders yi pour nga nit ñi gëm ne feebar bi digal sa ko dama ñun suñ culture. Man believe naa ne président bu génn see laakal ñu soose laaka ñu olof laaka ñu pël moom moo fi déggal loolu rek moom kese saraxule toog si télé bi mu wax ko rajo yëpp transmit ko xam naa ne every week mu génn def loolu dafa tax nit ñi ñu gën a gëm feebar bi.
Absolutely.
Loolu nit ñi dañ dee foog ne lu ndaw la waaye it's very important because kii moom mooy suñ leader su waxee rek dañ koy déglu gisuloo tey dégloo ñëpp ñu ngi dañ bëgg a dégg président nekkut ne dañ na ma waxam de waaye nga moom bu waxee rek daf tee tax ñu toogoon ñëpp jóg taxaw ñu nelawoon ñëpp jóg taxaw. It's important when the leaders speak to us. I think that is something loo xam ne xëy na Still House dinañ ko.
And I think it's good also to show the people that he is empathizing with the situation and he is putting things in place. Obviously, ñu ko jël ñu jox ko keneen Dr. Samate moom moo nekk in charge, but it's good to see the head of the family, so to speak, come and reassure, to say we are fighting this together, we are going to do this, even if it's 30 seconds. That is so reassuring. Because I was going to say, Boris Johnson, for instance. Boris Johnson, I got there. Can you look at one seriously?
Yep.
Everybody criticized Boris. Boris then you misinterpret Lungwa.
Wow.
This is COVID Boris Johnson showed true leadership.
Yeah.
True leadership. Every time, although obviously health minister or whoever else, take care of the stuff, but he was always present. Always present to take questions, to reassure, not only reassure the public, but also the people around him. Until February, when he came out of hospital, he did a video. It wasn't live, but we knew that he was healthy, we knew he was fine, and it was reassuring to see. And I think that the Gambian public needs that. They need that reassurance. They need our president, sir. We need you to come out and reassure us. Show empathy and tell us that you're in this with us. We're in this together. Because from it's every man for himself. You know, Gambians are panicking. And I think that in this sort of state, it would unify us even further. So you know, it's gonna be okay. We've made mistakes along the way, but we're looking at it and we're gonna rectify it. Because Nyata government, Rome, for instance, said Prime Minister, Mom, at first it was the same thing. They were not listening and they made mistakes. But what did he do? He came in front of the TV, they've done joy. And he said, we made mistakes. I am sorry. We made mistakes and I failed my people, but we're gonna rectify those mistakes. And they did. So it's very reassuring to have that. But unfortunately, Gambia, we're still waiting patiently. Because I'm a Gambian, bit of patience. To a certain degree.
Yeah, so I don't want to sound political, but it is good to sound political here because as you both said, it is very important to show example. Leadership is by showing example. And I have said it over and over that, you know, you cannot tell my poor, you know, auntie in Jara that, she shouldn't go out to the Lumo. She shouldn't go out to the garden because of the virus. But you, the one telling her not to go out, have a political party, have a, an entourage that is doing activities that are contrary to what you are telling my aunt. That is a problem. And that is a problem of leadership. Yeah. You cannot be, as a leader, reminded to do what you are telling others to do. That is not correct. That is not correct. So it's about leadership. We show example of what we want our people to do. We show example of how we want our people to, act in society. It's about showing our people what we want them to do in society. You don't, as a leader, have to be reminded what to do when you are telling people what to do. And the other day I saw Uncle Peter reminding the president to wear the mask, which is not correct. He should have been reminding Uncle Peter to wear the mask. How will my uncle, my cousins in Jara see that? If I follow Hanim president of Avocado. Hanim president of Avocado.
Yeah, of course.
It's a genuine excuse. Yeah. It's a genuine excuse. So we need to show example. Leadership, once you become a leader, you become restricted from that liberty of doing some things because everybody has his or her eye on you now. You become out of, that private life. So whatever you're gonna do, so you make sure that you minimize as much as you can the mistakes that will come on the way. That is the way the leader should do. And this is what I want our country to do. We cannot tell people not to go to the workshop. We cannot tell people not to go to the gatherings and the like when we are doing contrary to what we are telling them. When we are doing contrary to what we are telling them. You made example of Governor Como. Governor Como is a presidential. He's doing exactly what the leader should do. He's showing the example to society. He's showing example to us New Yorkers what we have to do, how we need to, live as people in this state of, pandemic. And not only that, he's taking responsibility for each and every mistake that comes along the way.
Yeah.
I said on the live video when Mr. Jai was on, he was talking about commendation. I said, you don't ask for commendation. You don't ask for it. People give it to you voluntarily. Yeah. You don't ask for people to commend you. You do, and then people see what you are doing and they commend you for it.
Absolutely.
Yeah, but people will have the right to criticize you so that you could do better. So asking for commendation, it means you are not sure of more of what you are doing and you want people to recognize the little you are doing. That is not correct in leadership. In leadership, you do for people to commend you if they want. It's voluntary.
Yeah.
Yeah, so that is what we need to do. We need to exercise the leadership from the president to the last person. Whoever is involved, exercise leadership, even at our own homes. Fatou at her home will, demonstrate the leadership to Keba. When my nephew looks at her wearing the mask, he will know that he has to wear the mask. When my nephew sees her washing her hands, he will know that, hey, so I am the same thing. So leadership is everywhere, and we need to exercise it everywhere we are, from the president to the last person. That is the only way we could do better with this disease.
Yeah, well, that is the only way we can do better. I think the doctor, I took more of your time because you were supposed to leave. So what's your final message before you leave to those that are watching? We will be doing this every day. So I'll bring in some experts. Tomorrow I'm going to have the medical pharmacy council, members of the pharmacy council to come talk to us, because apparently there are some people who are also doing testings at their private centers without the approval of the government. So we'll have a conversation surrounding that. So what's your final message to
so my final message to every Gambian first is reassurance. We don't have to give up. We need to believe that we can overcome it, just like Italy they overcome the virus. It was not through a miracle. It was through effort that they overcome, the virus. We can do the same thing as well as Gambians. But the way we could do it as Gambians is by following the outlined prescribed measures. We follow the measures and see it as we are helping ourselves and not government. And also the government must provide the support, the political will to ensure that, everything is done the right way, and then we give the virus the back in the soonest possible time. And thank you to both of you. And it was a pleasure to be here. Thank you, Fatou.
Thank you
and
so
thank
much,
you,
doctor.
sister.
All right. Thank you, doctor. Thank you so much.
Thank you, Dr. Manyenya.
Yes.
Manyenya, looy tëjee nag loo bëgg a wax Gambia ni nga xam ne ñu ngi laa seete man daal I think we should talk to our people. Xew yu bari yu si dëkk bi.
Absolutely, we should never stop. Hence the reason why, if you've noticed, I've been on several platforms, and not as an expert, but we need to speak up.
Yeah.
Fatou today defna manwaruma def tay. If you have something to say, come out there, because dina am ñoo xamne ñu la sétane ñi duñ dé mëna sétane Fatou today. So it's good for us to come out and speak up. Let us speak about this. Let us speak about our experiences. Let us share whatever it is that we think we know, however little it is. Like for instance, Ifinyasi, man, she helped me with regards to the mask, the way she explained it and everything else. Man,
and I'll definitely want to have her on maybe.
No, seriously.
Tomorrow or gonna tomorrow. I'll reach out because it's important to do these experts, especially in other countries.
Yes.
When they speak, I remember this girl, this lady, Kadibaro, defa video, and I shared it on Kerr. One health official, Momo call neman video bobo ma send koko. I guess that would be very helpful.
It is helpful.
Important. People like
that come out as well.
Yeah, ñu leen dee jox ñu wax ñoom si suñ platform yi ndax ñu bari mun leen a dégga.
It is very helpful, and we have to have these discussions as well. You know, we have to talk. We have to talk as a nation. We can't always just point fingers at the government. We need to take individual responsibility. We need to adhere to the rules that has been given to us. And this is no time for help. You know, if you live to 2021, then you can help as much as you like, because at least time, Bobo, the world would have had a chance to really study this properly, probably come up with a vaccine. You never know. But for now, we're in this together. You know, we're definitely in this together. And I think we need to stay focused as well. It's a time to reflect and see, you know, how we become better as a nation. Because Gambia is small. So just imagine, you know, you're invincible. Nobody's invincible when it comes to corona. Nobody is. So we have to adhere to the rules. You know, wear your face mask properly. And also social distance, and just stay away from, you know, stay away from nightclubs. Partying ginti for what? For what? You bari si ay party ak ay ngente lañ nekk di amee lii.
And man,
you know,
xam nga ñun xale yi, the younger people dañ dee foog ne because ñoom nekkuñ di dégg comme Gambia nekkuñ di dégg lu bari xale yi di dee, mag yi ñoo nekk di dee, waaye mag yi demuñ de. ñun xale yi ñoo dee dem jël feebar bi indi ko jox ko suñ mag yi, because mag yi ñu ngi am underlying condition si kër yi, ñu ngi am seen high blood pressure, ñu ngi am heart condition, ñu ngi am lii. Xam nga ñoom seen immune system bi is already weak. Boo leen indi feebar dañoo teel a gaañu, waaye yow mi ko indi yaa ngi daw a feebar bi because yaa ngi exercise, yaa ngi lekk well, yaa ngi am strong immune system, defut la lu mel ni mu def meer bi. So yow yaa ngi foog ne you're okay. But this is what we're doing. We're bringing the feebar to the vulnerable people in our homes. And this is what is happening right now. Kilifa yépp nga feebar si dëkk bi. You ask for any other person, ñu ne la feebar na. Ba pare man li ma jaaxal dangaa eewu rek nit dem nañ dëj lu ko rey xamuloo ko. Time bii lañ war a wàññi dem dëj yi nañ yónnee message ñu call jaale, waaye nag ku eewu rek dem nga dëj te yoo xamuloo kooku lu ko rey. These are scary times. I am scared to
you know the thing is, the government and experts and stuff can come up with all the things that we can do. And they want to try and implement it. Us as citizens, if we do not adhere to these things, how are we going to get out of this? So we all have a role to play, and each and every role is equally important. Is equally important, because our actions can cause a domino effect easily. So please, then stay at home. Don't go out if you don't. Man, go ahead. There's a state of emergency in Gambia as we speak. Because man, somebody say in videos and people start telling me what's going on in Gambia. I'm like, really?
Man, you have a dem marse. Bo duge si bo rombe marse. Bo rombe yoni marse bi. Da nga endu sa loxo ndax ñun state of emergency lañ am ndax ñun lan lañ am. But the thing is, gis nga bu COVID bi started the enforcement was crazy. dañ am time boo xam ne time bi nit ñi war a dem marché kañ lañ ak ñoo xam ne ñoo war a jaay marché and enforcement bi was strict KMC ñu ngi doon liggéey ak security forces it was good buñ defee loolu rek people started complaining ñun social media ñoo dooroon di complain ñu ngee door nit ñi ñu ngee def li ñu ngee def li ñu stay back they stayed back and now ñu bàyyi marché yi ubbi nañ anytime any day soo demee si marché yaa ngi packed. So at the end of the day, man, sometimes you know why you danga ragal sa because in as much as yaa ngi protect sa bopp yow yaa ngi protect but foog kenn a jógee sa kër dem marché. Bu demee marché there's no way bu demee marché dafa interact ak nit ñi.
Yeah.
Bu ñëwee nag every day bu ñëwee nga ne ko simeekul demal jël omo ak ordre sewel dem sangu. You know, for how long can you do this? It's so painful and it's so confusing to the point though they hamsa how you were able to protect yourself. Yange have all these precautions at home, but at least one person will school see right now. Then tell you school see right now grade 12 see a grade 9 see ubinen len. Monday suma hale bi ci kër gi sire. Maneko dal ñu repeat why grade 12 togal nga xaar. Because it's scary.
It is very scary. It is.
Reality
Why, like I said, again, I will reiterate on that.
Mm-hmm.
People in the government need to come out and speak.
Yeah.
Not just the Ministry of Health, wax ñu figures, gen ñoo tital, wax ñu ne ki dee na. Man, I've, do you know what? I'm not gonna lie. I've watched a couple of their Sengai briefings in DLF.
Mm-hmm.
I don't want to watch it anymore. Yeah. I just don't want to watch it anymore. That's my personal opinion because I feel like I am not reassured and I don't see empathy. You know, that's my own personal opinion.
Yeah.
And I feel that needs to be.
Yeah.
They need to come out.
Yeah.
They need to come out, they need to speak because the guy gis ne dama setan you send press conference bi madam ma setan Boris Johnson if they work dama they feel like oh yes we're going to get through this dama they that reassurance bi nga xamne dama they feel like you know what I've got wings now I'm going to fly.
Yeah.
You know what I mean? You feel like yes we can do this. Okay, I'm going to go and start doing this. I'm going to buy my hand sanitizer gel. There's hope. You know, there's light at the end of the tunnel.
Yeah.
But if we don't have people coming out and reassuring, buñ sonas diñu reassure.
Yeah.
They have to do it. And it's not like they're doing us a favor. It's what they've been voted in to do. And it's what they're being paid by taxpayers' money to do.
Yeah. Yeah. And especially li gëna scary moy nga ew rek nga gis numbers yi ñew. Nga dem so rombe Banjul dead house yang fa fekka ñu fa def freezer bu mak pour dead bodies because mortuary bi mun ko li so xam nga loolu ñun miinuñ loolu Gambian bi xamut loolu so ku nekkaa ngi woore ku nekkaa ngi tiit I think it will be important li nga wax it will be important
very important
ñu am good communication person koo xam ne daf dina ñëw ci Gambian ni wax leen lii mooy situation bi xam naa ne yéen a ngay gis niw yi yéen a ngay gis dee bi yéen a ngay déggal lii ni deena si Covid dégga la waaye lii moo war a tax ba duñ am
ñu ngee def lii wow.
Yeah, I think that will be definitely be
important. No, that's important. It is very, very important. All these protocols and president wanted again all the time, the latte and what Fatou lolu fum nekk ni ñun ci do or die. Si situation boobu lañ nekk at the moment. There's a crisis. There is a crisis. The whole world is experiencing this. Te fum nekk ni it sa xaalis amatul benn use, amatul benn worth. Because sa xaalis mënut laa génne si dëkk bi because dëkk boo dem ñoom tamit ñu ngi looloo leen nekk di leen sonal. Exactly. So they're facing the same thing as well. So who do you think ban border foog nga ne UK dinañ génne minister or some whoever indi leen Angleterre ne leen dafa am COVID dañ ko indi ñëw treat ko fii doo duga. They will not let you come in. No. So we have to make sure that we are putting in implementing things and the people are adhering to that. And this is not a political thing when we say President Manyenya. No, we are begging, we're asking, we need reassurance because sometimes so they may bet them as a halal, so to speak. You want to look back and make sure that there's someone behind you who's hunger, encourage. And I think Gambians don't have that. And plus, if I'm not Gambia, mënuñoo gëm feebar bi to that extent because the people who should come out and speak and say how serious this is aren't doing it. You know, because the last time you saw your His Excellency Munyo out and he spoke, he did not even go off script. He just read what he had to read, and that was it. That was it. You know, that I guess yeneen presidents yoo xam ne su ñoo read dañoo read lu ñoo read waaye da ngaa gis they would look directly into the camera and reassure you pour wax la ne lii métti na for all of us, but we're gonna get through this. Benn sentence boobu rek daf la dee jox a peace of mind, you know. But we haven't had that, and we desperately need that. And this is coming from people ñoo xam ne have no political affiliation like myself. Bokkuma fenn nag falu bokkuma fenn. But it's just concerned citizens. Understand that?
Definitely.
So they need to do more. They need to do more. Minister of Health, come on, then go isolate, right? Talib, for instance. Oh my God, that gentleman.
Yeah.
Seriously, Talib is a different breed. Hamga. Talib came out. You could see in his eyes, he's trying to be brave. Why do you have he's tired. He looks tired. But he came out and he spoke.
Yeah.
He spoke and he was reassuring.
Yeah, and he assured us that he's doing fine.
Yes.
We are worried when our leaders are sick. We are worried.
Exactly.
We want out to know. And tell us, yes, I am sick, but I'm doing well.
Exactly.
That is very important.
The Ministry of Health, if you're watching, you know, I'm not again in this Fatou because send Fatou, you know, would like to hear from the ministry, the minister himself. You know, Pulne. Don't worry, Hamnane, you guys are worried because everybody you can send message and you know, Pulmutane, Vice President did the same thing. Everybody is sending messages and saying every nice stuff. It's nice to come back and say, don't worry, we're fine, we're doing okay. We'll get through this. Understand that? Yeah. We need that. We need that. Gambia definitely needs that. But it's a fight that's going on all over the world. And inshallah, Rabbi, we will get through this. This shall pass.
Fatou is just telling me that he just read that the president is coming out tonight. So let me see.
Hopefully it's not just a script he's coming to read, but it's going to be like a heart-to-heart with his people.
Yeah, I have not yet received anything on our Kerr Fatou page, but yeah, so I'll check with the State House, but that would be important that the president comes out.
Yeah, he needs to have a heart-to-heart, not a script. Not don't go by a script. Yeah, we know you have to go by protocol or whatever, but sometimes it's good when you have crisis, go off script a bit, be human, don't be presidential, be human. So we can feel that you feel what we are feeling too, because Ninyang Day, and we haven't even reached the peak yet of it.
Yeah,
you know,
this is scary.
So
yeah, it's scary.
It is.
I think we will get through this, and it's about time, you know, we all come together and join the fight. People like Kogisi Manyenya Mugina rek xamal ne amna lu xew because she's always in her corner. So I think these are times yoo xam ne every Gambian ko xam ne am na voice rek war na génna waxa askan bi war naa dégg si suñ kilifa yi. And then I think last time the president spoke, he spoke in the local languages. I love that because he was speaking directly to us. And when he does that, it a lot of impact. And I hope this.
When was the last time he spoke? You can't remember. It's that long.
Yeah, it's some few months ago. Yeah, a few months ago. So yes, he did speak after the first time. The second time he spoke in the local languages, and I think that was effective. A lot of people understood what he was saying, and people felt like he spoke from his heart, and that will be important. Let's see how it goes today. I hope he speaks directly from his heart to us and wax ñu the importance of ak feebar bi naka la deadly ak Gambians yi naka lañ war a taxawee moom si boppam cabinet am ñaat nit ñi am nañ ko fa apart from the cabinet members so many other people also tested and mu wax de cabinet su dee State House si boppam corona dugga na fi mun na dugga fu nekka.
I'm curious. I'm quite curious to know how did that happen? What happened? Zoom amuton, internet amuton State House. Guy muna def Zoom meetings because that's what everybody is doing all over the world.
I know.
I don't understand.
Gambia, I think from the Gambia, then you are the door, the make use of technology. Because we keep on doing things the traditional way, and time dafa jot pour ñu move away from those. Come like ñun fii, right? Even book li doore su ma la waxee ne pour am Zoom properly installed as a thing that mun nañ koo use, what, 2 weeks ago laa ko def. And those, it's about time. It's the same. It's the same as the same system. This is even less hamga, less easier. It's easier for me to do. My team, everybody is doing their business. So hanga lolu is not. Sometimes then they banya def certain things. Why more gina nopal sa hamga. So I think muy state house, muy ministries, muy departments, people should start looking at technology now. Hamne, there's a new normal, and the new normal is things are not normal anymore. Am pour sol mask juma julli jotna. Yang ñu ngi sa noda ba ngi noda. Wa fom na ni dinañ kay wa léegi te noda ñu ne kenn du ko fay, right? Loolu lañ wax. Kon de mu ngi ni Manyenya ma bàyyi la nga tàggoo ndax ñu mun a bàyyi ni waxtu julli jot na. Looy tàggoo foog mu jee bala nga tàggoo.
Dañu wax ne soo déggee nooda waruloo wax ci kaw nooda bi, you know, ma ne ko ñu ngi trifle waaji baakaare ndax du.
Okay.
Well, man, what I'd like to say is thank you for having me.
Yeah.
I do appreciate the fact that we're having these conversations. And like I said, you don't have to be a Fatou Toure or a Manyenya Dambell. If you've got something to say, share it with the public. We would love to hear from you. And also let us take individual responsibility. Like I said before, individual responsibility. And let us adhere to what is being said by the Ministry of Health and also WHO. You know, keep ourselves updated. You know, make sure ne suñ xale yi si kër gi buñ bàyyi xale yi di dem foyi disability, because xale yi sax mun nañ ko indiwaat. You know, when you're out there si marché yi, try leen rek ngeen social distance tuuti. And also government bi tamit nañ try to come out more and speak to the public and reassure, because léegi fu mu nekk nii dafa mel ni we're having 100+ cases a day. Is that what's happening now? 100+ cases a day.
Yes.
Yeah.
Yes.
So it's getting more serious. It wasn't like the Bena case, Nyari case, or whatever that we used to have. So things are getting more serious, and I think people need to get more serious as well. But like I said, this too shall pass, and we will get through this together, united. We will definitely get through this. So man lola amon po, and thank you everybody for watching as well.
Thank you very much, Manyenya. One more time, the ñi nga xam ne yëpp they infected di leen ñaanal yàlla.
Absolutely.
Faj leen si lu gën a gaaw ndax ñu mun a dellu si seen liggéey sakatuma ñoo xam ne si public officials and ñu ngi hold public office dëkk bi soxla na leen at this trying times. Ku mel ni Dr. Samate fu ñu toll nii tey moom moo lead fight bi, kon kooku dañ ko war a ñaanal feebar bi mu gën cee jóg.
Absolutely, definitely. Because
wow, mom.
Real quickly, because I mean, such frontliners, doctors, nurses, we need to encourage them and show appreciation. If I mean, if we every Thursday evening, you gain a tattoo land. You know, we need to show that, encourage them, and you know, just be there for them as well, because their mental health also would be affected.
Man, sometimes, most of the time, during this pandemic, I reserve a lot of my comments when it comes to the health officials, because ñu si pandemic and ñoom ñu ngi sacrifice ñoom seen life.
Absolutely.
Families seen life, because dañoo dem si lopitaan yi ñu jël feebar yi yóbbu ko seen kër yi dem delluwaat si lopitaan yi, and it's a big risk xam nga te resources yi doyut ñu mun leen a fay xaalis bu bari. Kon health officials yëpp ñi nga xam ne feebar bi daaneel na leen ñu ngi leen a ñaanal ndax yàlla jël feebar bi seen kaw lu gaaw ndax ñu mun a dem liggéeyal réew mi, because ñoom liggéey bu ñoo def health officials across the world liggéey bu ñoo def si jamono juñ tollu nii kenn mënu koo fay, kenn benn xaalis mënu koo fay, because yow xam nga ne war ngaa mun a feebar waaye every day yaa ngi jóg sa kër pour dem faji keneen. Loolu bugga sa liggéey rek bugga sa réew bugga askan moo ko mun. Kon health officials yëpp ñu ngi leen a wish a speedy recovery.
We salute them. We salute each and every one of them that are out there fighting the fight with us. You know, they're doing such a big So we're very proud of them, and I think we need to start an initiative whereby we can also do like the NHS fee hanga when they come every evening and clap for the NHS workers. We can do not something similar, but we can do something low hamne. Didn't want appreciation, you know. That's really important.
That's important. And then soon leaders itam ñi nga xamne ñu ngi tëdda ku melni vice president ak minister si
yalla leen yalla joxtane wa
yalla joxtane tey bu vice president febaré bu health finance minister febaré mom mo wara dem lijanti xaalis réew mi naka lañ ko doxale koku war naa mun a jóg su lu dellu si liggéeyam ku mel ni health minister man moom dama ne every single day suma ñaan num gaaw tuuti man ko ñaanal ndax mu mun a
wow moom taxawoon na trop sa moom he was
wow definitely Dr. Samate taxawoon na trop
Dr. Samate was he's a hero.
He's a hero.
He's definitely a hero.
Yeah, he's always been my hero, and I just
he's tried a lot. You can see that at some point you can see that his hands are tied. He wants to do so much, but there's so little he can do. You know. So we're all in this together. Amut ne ki fila neka ki party bila neka ki falila deka ki brikamla neka ki mungi Georgetown ki mungi fale. No, we're all in this together as Gambian citizens. Period.
And then kitam naka la tudda suñu leet mayo bi Talib suma xarit moom xale bu baax la def liggéey bu baax ñu ko ñaanal moom tamit mu am tane lu gaaw mu ñëw KMC region bu mag la
he's done such a great job as well. He's done a great job.
Mom from day one mu ngi ci launch mask mu ngi ci launch lii mu ngi make sure di protect, and he's been so careful. I remember maa ngi ko oyoon pour interview mu ne ma Fatou ak ni ma la bugga ñëwal suma office man duma lay dem si kenn pour interview because I can control what is in my office. I have 2 beautiful young kids, so I don't want to take the virus to them. This has always been his message.
Ndeysaan
bi ma déggee démba dama déglu li ma waxoon rek xam ne he was very careful. Loolu moo laa woon ne virus bi ak noo mun a careful bu jotee si yow rek
absolutely
ñëw. So ñu ñaanal ko moom tam ndax mu gën a gaaw mu tane dem si njobootam bi. I think it's important ñu ñaanal ñëpp daal Gambie yëpp ñu ñaanal leen waa MRC ñeneen ñoom tam they're badly affected ñoom tam.
And also I think the people that we also tend to forget are the cleaners that are in the hospitals. Understand, they're doing a great job. We need to commend those people. I think now we have to do something like that. We celebrate those people, so we encourage. You frontline workers, you need that encouragement as well. You know, because imagine without them, what are we going to do? What are we going to do? So we definitely need to praise those people, commend them, and whatever else. But the people at the top above, it's what you're there to do. So just do you, and jaman enjoy it all.
Inshallah. Inshallah. Thank you very much, Nina Muso. So we'll
thank you so much. It's been a pleasure. It's been a pleasure. Let's keep it going. Let's keep talking. Let's keep sensitizing. It's very, very important.
Very important. Dinaa la call later schedule la kañ la ñoo ñëwaat dégg nga dinaa la call later on yow fu mu ne nii liggéeyu loo covid moo am yéen a ngi tëju kon daal nañ covid fii
no anytime yoo xam nga ñaata notice nga ma jox xam nga yow suma waay
10 minutes notice laa ko jox 10 minutes ma ne ko may 10 minutes suma guest bi mënut a ñëw you have to come on board.
Anytime for you, darling. Anytime.
Thank you.
My pleasure.
Thank you, darling. Okay.
All right. Come later. Do I leave? I'm
about Harold dinner end, Legi Harold.
End. Okay, cool.
Thank you guys for watching.
Excellent.
Bye. Bye. See you tomorrow. Bye.
All right. Bye.